anomaly to most Americans around the country until it now hits home. Bill Gnatchibag, coming to you live with reports of the Ebola virus sweeping a town in our very own country. Ebola, which first emerged in Zaire 13 years ago, has stayed dormant for all those years. But now, is it about to rear its deadly head once again? We go straight to the field with Tom Shafer reporting live from Reston, Virginia, where the outbreak is occurring. Tom?
Thanks, Bill. I'm here in the safe zone of the peaceful town of Reston, at least peaceful until now. Slowly, the residents of the city are being taken down by the virus at a devastating rate.
Tom, do you have a infected rate account at the moment?
Well, so far, Bill, they haven't released the count on total infected citizens because they don't actually know. But they do know that 37 people displaying symptoms of the Ebola virus arrived at Reston Memorial Hospital between 6 o'clock yesterday and time of containment. Unfortunately, they have not yet found the primary source, so they are unsure as to whether it is fully contained or not. Citizens are being advised to remain inside their homes for the time being until the source can be identified. Thank you, Bill. We'll keep you posted up in the situation.
Okay, thank you, Tom. Now, the Ebola virus is relatively unheard of until now, so we're going to take you to Dr. Richard Marfuji at the CDC in Georgia. He's been studying this virus since its discovery in 1976. Richard?
Well, Bill, the reason Ebola incidents have rarely been in the public eye until now is due to the transmission. The virus is transmitted primarily through body fluids, primarily mucous membrane contact. Usually areas in Africa have seen outbreaks of the disease due to poor living conditions and close contact with monkeys. However, the disease has difficulty spreading by airborne transmission, and thus does not spread between isolated locales in Africa, but still manages to damage the population severely. In fact, the strain that broke out in Zaire 13 years ago has one of the highest case fatality rates of any pathogenic virus, roughly 90% casualties, making it extremely dangerous, but also much easier to contain. It is classified as a Category A bioterrorism agent due to its potential as a weapon of biological warfare. In its earliest stages, Ebola is not highly contagious. However, as it progresses, bodily fluids can represent a biohazard. Initial symptoms are similar to malaria, typhoid fever, dysentery, the flu, and other common and less fatal infections, thus being a greater risk for going unnoticed until it is too late. More serious symptoms such as diarrhea, vomiting blood, and tachycardia may result, and eventually death, primarily from hypovolemic shock, similar to dehydration but with blood instead of water. There are no known ways and treatments thus far, but taking natural precautions and staying wary of possible infections are always vital. Just try to stay smart. As this incident in Virginia has opened the public eye, many public health programs should soon fall in place, raising support and awareness to fight this deadly disease.
Thank you, Richard. We here at CNN are also doing our part in preventing Ebola from reaching our coasts, whether transmitted by tourists or infected monkeys as suspected in the Reston incident. If you would like to donate money to this fund, simply call 1-800-923-5957. But knowing is only half the battle. Make sure your community is aware of the symptoms of Ebola. Stay away from those who are sick, whether Ebola or not. And always remember to stay aware. Ebola's greatest weapon is our own ignorance, folks. Thank you for tuning in tonight to CNN Nightly News. I'm Bill Gnatchibag, signing off. Now for your local programs.
Hey, Alex, what's going on?
Oh, hey Nolan, what's up?
Oh, not much. How about you?
Well, Nolan, I'm going to New York with you. You know the Global Organization of Health, the leaders of helping global public health. Well, they gave me a job as project supervisor for as long as you're the manager.
Look, Alex, if you're the project supervisor, you must know the names of all the groups around the world.
I certainly do.
Well, you know, I've never heard of the different groups, so you'll have to tell me their names, and then I'll know who's treating what around the world.
Well, I'll tell you their names, but, you know, it seems to me that they shorten everything down to a nail nowadays, as short as they can get.
You mean nicknames?
Strange names, short names, like WYSIWYG.
Like the programming thing?
Exactly. Well, let's see, we have around the world, who's researching Ebola, what's looking into malaria, I don't know's working on Alzheimer's.
That's what I want to find out. I say who's on Ebola, what's on malaria, I don't know who's on Alzheimer's. You're the project supervisor, aren't you?
Yes.
Are you in charge of all different groups working together around the world?
Well, yes.
And you don't know the organization's names?
Well, I should.
Well, then who's on Ebola?
Well, yes.
I mean the group's name.
Who?
The group trying to cure Ebola.
Who?
The researchers of Ebola around the world.
Who's researching Ebola?
I'm asking you who's on Ebola.
Yes.
Well, go ahead and tell me.
That's it.
That's who.
Yes.
Look, you fund a group who's working on finding a cure for Ebola.
Certainly.
Who's working on that then?
That's right.
When you send funds to that group every month, who gets the money?
Every dollar of it.
All I'm trying to find out is that the group's name is Researching Ebola.
Who?
The group that gets...
That's it.
Who gets the money?
They do. Every dollar of it. Sometimes their leader comes down in person and collects it.
Whose wife?
But yes. What's wrong with that?
Look, all I want to know is when you sign up for tackling a disease, how do they sign their name?
Like you said, who?
The group.
Who?
How do they sign?
That's how they sign it.
Who?
Yes.
All I'm trying to find out is what's the group's name working on Ebola.
No, what's working on malaria?
I'm not asking who's reaching your malaria.
Who's on Ebola?
One disease at a time.
Well, don't change the groups around.
I'm not changing anything.
Take it easy, buddy.
I'm only asking you who's the group on Ebola.
That's right.
Okay.
All right.
What's the group's name working on Ebola?
No, what is working on malaria?
I'm not asking you who's working on malaria.
Who is on Ebola?
I don't know.
They're researching Alzheimer's. We're not talking about them yet.
How did I get on the subject of Alzheimer's?
You mentioned their name.
I mentioned the Alzheimer's group name. Who did I say is researching Alzheimer's?
No, who's researching Ebola?
What's on Ebola?
What's on malaria?
I don't know.
They're on Alzheimer's.
There I go, back on Alzheimer's again. Would you just say on Alzheimer's and don't go off it?
All right, what do you want to know?
Now, who is looking into Alzheimer's?
Why do you insist on putting who on looking into Alzheimer's?
What am I putting onto Alzheimer's?
No, what is on malaria?
You don't want who on malaria?
Who is on Ebola?
I don't know.
Alzheimer's.
Wow. Look, you got a tuberculosis research team?
Sure.
What's their name?
Why?
I just thought I'd ask you.
Well, I just thought I'd tell you.
Then tell me who's working on tuberculosis.
Who's working on Ebola?
I'm not. Stay out of Ebola research. I don't want to know what's the group's name on tuberculosis.
No, what's on malaria?
I'm not asking you who's on malaria.
Who's on Ebola?
I don't know. Alzheimer's.
Alzheimer's.
Oh my gosh. The tuberculosis researchers.
Why?
Because.
Oh, they're working on typhoid fever.
Look, you got a team working on the measles.
Sure.
The team's name.
Tomorrow.
You don't want to tell me today?
I'm telling you now.
Then go ahead.
Tomorrow.
What time?
What time what?
What time tomorrow are you going to tell me who's researching typhoid?
Now listen. Who is not researching typhoid?
I'll break your arm if you say who's on Ebola. I don't want to know. I want to know what's the typhoid research group's name.
What's on malaria?
I don't know.
Alzheimer's.
Look, you got a mumps research team?
Certainly.
Their name?
Today.
Today and tomorrow is assisting those with the measles.
Now you've got it.
All we got is a couple of days in this organization. You know, I'm a missionary to assist villagers with mumps, too.
So they tell me.
I go to India to assist a town where most of the people have mumps. Tomorrow told me there may be a connection between the mumps patients being susceptible to Ebola. To confirm this, I got to call a team of researchers currently specializing in Ebola research. So I pick up the phone and dial who.
Now that's the first thing you've got right.
I don't even know what I'm talking about.
Well, that's all you have to do.
Is call up an Ebola specialist?
Yes.
Now, who's on the phone?
Naturally.
Look, if I call up the team, somebody's got to get it. Now, who's on the phone?
Naturally.
Who?
Naturally.
Naturally?
Naturally.
So I pick up the phone and talk to Naturally.
No, you don't. You talk to who?
Naturally?
That's different.
That's what I said.
You're not saying it.
I pick up and I call Naturally.
You call up who?
Naturally.
That's it.
That's what I said.
You ask me.
I pick up the phone and call who?
Naturally.
Now you ask me.
You pick up the phone and call who?
Naturally.
That's it.
Same as you, same as you. I pick up the phone and call who? Whoever it is doesn't know and tells me he will patch me through to what? What patches it through? I don't know. I don't know what patches it back to tomorrow. I'm back where I began. I hang up and I decided to call it because. Why? I don't know. They are researching typhoid fever and I don't give a darn.
What?
I said I don't give a darn.
Oh, well they're researching rubella.